Hi, my name is Dr. Tori Hudson. I'm a member of the Pharmaca Integrative Health Advisory Board. And I'd like to talk to you today about bone health. We get a lot of questions about bone health, and of course my patients ask a lot of questions about bone health. I'm a naturopathic physician and been in practice for 28 years, and so women's health is my specialty. So our bone changes over time. And as we get older, and for women that's starting at about age 50 and menopause, which is hormonal changes, that bone loss happens a little bit faster. So in the first 4 years of menopause, we lose about 2% of our bone density per year for those first 4 or 5 years. So that's when there is the time of most rapid bone loss when we're talking about kind of normal, natural menopause. And over time, what we're concerned about is bone density, bone strength, and bone architecture. And so there are some general preventive things, and then there for all of us should be thinking of, but then there are special things for when someone might actually have osteoporosis or mild low bone density, which you might see your doctor call or on a report called osteopenia. But it's kind of normal, mild, and then osteoporosis. And then there's different degrees of osteoporosis. And the big issue with osteoporosis is the risk of fractures. That's really why we care about it, is the risk of fracturing, especially the big bones in our spine called the vertebrae or our hip. Those are the two most common sites of fracture. But wrists are another sort of, I think, the third common site. So obviously, we have to put in a plug for diet and exercise, and regular weight-bearing exercise is fundamental to good bone health throughout our lifetime, and good, sound dietary habits are important throughout our lifetime. There are some foods that cause more calcium loss than others, like lots of coffee. I don't mean a cup or two a day. I mean lots of coffee over lots of years, high sugar diets, high soda pop diets, a calcium deficient diet. These are the things that kind of put us at risk for low bone density. But the number one reason why women get osteoporosis is actually a family history. That accounts for about 80 to 85% of the reason a woman does in fact get osteoporosis. So we need to have these strategies in place to help prevent something that's above and beyond a normal amount of bone loss. And then even if we are losing bone, what can we do to make our bones stronger, the architecture stronger, the bone strength stronger, and help us to not fall? Actually, improving muscle strength actually helps us to not fall. And one of the most important nutrients to help improve muscle strength is actually vitamin D. And people aren't often aware of that aspect of vitamin D on bone health, but if you have good muscle strength, then you're less likely to fall, or you're more likely to fall better, you might say. But vitamin D is also imperative in the absorption of calcium and direct effects on the bone itself. So vitamin D, there are guidelines that are kind of changing all the time, but the Institute of Medicine recently had some in the last year or two, the sort of update of the vitamin D guidelines. And you can look at that based on your age and what the guidelines are for you. So vitamin D3 is often thought to be the preferred form of vitamin D just because it's a more potent at the same number of units, we think, although there's a little controversial. So an optimal bone health supplement would have vitamin D in it. And then the other sort of part of the dynamic duo is calcium. That's kind of, so I tell my patients the two most important nutrients are the calcium and vitamin D. That's kind of like having a car that has wheels and a steering wheel and gas. But what about a supplement that has, leather seats, a nice little GPS system, an FM radio, air conditioning? Now we get into fancier bone supplements because there are these other nutrients that also affect bone density, bone architecture, and bone strength. So then you look at a little bit more holistic, or we might say comprehensive bone health supplement that has manganese and copper and magnesium and vitamin K and selenium and folic acid. And sort of those are the kinds of higher end, more broad spectrum, more comprehensive bone health supplements. So I think that if you keep those basic things in mind, along with good healthy habits and good nutrition, good exercise, a good bone health supplement. Talk to your doctor if you have more questions, because there are, at age 65, we actually do prefer to do a bone density test on all women. Some women might need it earlier. So those are the kinds of questions for your doctor. And if you do have osteoporosis, should you consider a medication along with a bone health supplement? That's an important part of the conversation as well. And other questions about nutrition and nutrients, you can certainly talk to one of the excellent staff members at a Pharmaca store.